Hello and welcome to the next episode of the Explainer series with the host Dr Bret Palmer, and I'm going to explain in this episode what genitourinary medicine is, otherwise known as GUM or GUM. Now in the UK, GUM is a specific medical specialty, and it is the medical side of urology and the medical side of gynecology. So GUM is also sometimes called sexual health and HIV medicine, and sometimes some people will just say I'm a sexual health practitioner. So what does it encompass? Well, apart from the medical side of urology and the medical side of gynecology, because both urology and gynecology are surgical specialties, we also take on dermatology around the genital area. We also take on contraception, and we also take on other psychosexual problems to do with anything to do with the genitals, really. There are sometimes problems with the genitals that we can't necessarily deal with, in which case then if it's a surgical problem, the boys go to the urologists and the girls go to the gynecologists. In terms of other problems with the genitals which we may not be able to deal with, or we may have trouble, it does depend on the size of the unit. So the bigger units, say for example in London, Birmingham, Bristol, Edinburgh, Cardiff, Belfast, these tend to be very, very large units, and they can tend to do most things in the UK. I belong to quite a small unit in a small city called Bath, which is in the south of England, and for that particular size unit we sometimes send individuals to, for example, dermatology if we want a second opinion. With GM, it's not purely just genitals though. We also care for problems around the rectal area, and also some basic ear, nose and throat problems, especially if we think it is sexual health related. So there you go, GUM, genitourinary medicine, encompasses all of sexual health, a little bit of genital dermatology, contraception, and HIV medicine. So if you're a junior doctor and you've done most of your junior years, looking to specialise in a medical specialty, but you're not quite sure which, well, I would personally recommend genitourinary medicine. It tends to have a very good work-life balance, and the good thing about it is when you see a patient, you tend to obviously take the history, you diagnose most of it through the history, because most clinics also have a lab where we can diagnose there and then, and we can also start treatment. So we tend to do the whole clinical pathway in the first one or maybe 2 visits required. We also have long-term patients for either contraception and or dermatology, and also HIV patients, and we also deal with complex sexual health, and sometimes we see inpatients as well. And because I'm recommending GUM as a specialty, it's also being supported by BASH, which is the British Association of Sexual Health and HIV, BIVA, which is the British HIV Association. These are our 2 main bodies that oversee sexual health in the UK. So, see you then, and hopefully see you at the next conference, either the BASH or BIVA conference in the UK. For those wanting to go into sexual health, I highly recommend them. Take care. Bye-bye.